in developing countries, people with multi-drug resistant tuberculosis usually die because effective treatment is often impossible in poor countries. There are medicines that can keep you alive for such a long time, but sorry, we don't think it's possible. It's too complicated, it's too expensive. Sorry, you're all dead. If you treat a single patient, we will kick you out of the country. And that was exactly the time we thought, okay, this is the fight that we've been waiting for. This is Melquiades. We've got the drugs. We started treating him. And then I didn't see him for 15 years. And then when we had a World Bank meeting in Lima, he came to see me and he looked like this. Good morning, everybody. 안녕하십니까? 제가 5살 때 미국에 갔기 때문에 실례하겠습니다만 영어로 말씀드리겠습니다. I am so honored to be here. And as I listened to the words this morning that came out of this forum, the tension between so many different factions in the world today is exactly sort of the life I've been living for a long time. And so today, if you'll indulge me, I'm going to talk a little bit about how I got to where I am, but then also talk a little bit about what I have been finding here in Korea over the last few years that is both exhilarating and encouraging, but also worrisome in some ways. This is me. Let's see. And this is when I was about 4 years old. And I was born in Korea, and we lived in Sinchon, where my mother was a professor at Ewha University, and my father was a dental professor both at Seoul National and Yonsei. And this is where we started. The two people, the older people, were my great-grandfather and great-grandmother, who we were very close to. Now, at the time that picture was taken, officially, Korea was deemed a country that was too poor to receive a World Bank loan. They said Korea would find it difficult without foreign aid to provide its people with more than the bare necessities of life. I went back and looked at some of the documents about Korea at this time in 1960, 61, 62. And they basically said, look, Korea is a basket case. There's no way that they'll ever be able to pay back any loans. It would be unwise to give them a loan now because there's not enough economic activity for them to pay it back. In this context, we moved to the United States, and soon after we moved to the United States, the World Bank gave its first loan to Korea for a highway. But then the next loan in 1968 was for education. And again, within the World Bank, they ridiculed Korea for taking money for education, when in fact what they should have done is invest in more infrastructure. In the period that was very difficult, my parents decided to move us to the United States. And of course, the idea was that we were going to give us, the children, an opportunity to attend better schools and have a life that maybe would go beyond what we could have hoped for in Korea. I want to tell you a story about my father, which in so many ways describes the life that I've led up to now. So I first went away to school at Brown University. On my first semester home from Brown University, I flew back. My father picked me up at the airport, and he kind of casually said to me, "What do you want to study? What did you decide at Brown?" I said to my father, who was a dentist among the most practical people on the face of the earth. Dentists are very practical people. I said to my father, well, Dad, I got really excited about the Asian American movement and other movements that are so powerful at the time in the 1980s. So I think I'm going to study political science and philosophy and become a part of a movement. So my father slowly pulled the car over to the side of the road. If he were speaking Korean, at the time I didn't speak any Korean at all. If he were speaking Korean, I think he would have looked at me and said, you know, "야, 이 건방진 새끼야." He said something that it really defined the rest of my life. He said, look, go to medical school, and then after you finish your residency, you can study anything you want. And so it was this conflict between science and practicality, and also the sense, my mother being a Tege and Chushi scholar, my uncle being a theologian and philosopher, I've tried to balance for my entire life. Having moral clarity around how we apply the tools that we were learning in the science of medicine was the defining tension of my entire life. Now, I show you this picture. It's a university that I spent a lot of time in, both as a student and a professor. I went to medical school. I was so fortunate to get into a program where I was allowed to study both medicine and anthropology at the same time. And I met these two amazing people, Ophelia Dahl and Paul Farmer. Paul and I were in the same MD, PhD, a medical degree along with a PhD in anthropology. But I met these two. So here we were, two young men receiving both an MD degree and a PhD in anthropology from Harvard University, and we had a full scholarship to do it. He said to me, he said, Jim, with our ridiculously elaborate educations, what's the nature of our responsibility to the rest of the world? And so that question defined our work together. Really, this was when I was about, in my late 20s, for the next 40 years. Given all that we were receiving, what was the nature of our responsibility to the rest of the world? For Paul and Ophelia, they started out in Haiti. Many of you may not know, but Haiti is the poorest country in the Western Hemisphere. And it has been racked by violence and coup d'etat, and right now it's essentially a failed state. Gangs and literally criminals have taken over the running of the country, and it's a place of just enormous poverty, wonderful, fantastic, caring people, but it has been troubled. And so Paul decided that he and Ophelia were going to go down and they were going to begin a healthcare project in Haiti. And it was actually in the poorest part of Haiti, which was the poorest country in the Western Hemisphere. Paul is Catholic. The moral foundation he took, and we eventually all took, came from the Catholic Church. But Pope Leo has talked about what he called a preferential option for the poor. That comes from the teachings of the Catholic priests in Latin America, who themselves asked a very fundamental question. Their question was, if Jesus were in Latin America today, where would he be? Would he be with the generals and the oligarchs, the powerful, wealthy people who ruled their countries, or would he be with the poor? And their reading of Scripture was very clear. There's no question that he would have chosen to be with the poor. And so this term, preferential option for the poor, is very specific. The reason they call it a preferential option for the poor is they're saying, hey, we love everybody. We're Christians, we're priests, we love everybody. But we have a preference for the poor. We're going to focus on tackling poverty. We're going to focus on asking questions about why is there so much poverty? Why do some people have so much and others have so little? And so we took that idea, built this organization, and we had Jewish members of Partners in Health. We had Muslim members of Partners in Health. This wasn't a religious organization, but we rallied around the concept that with our ridiculously elaborate trainings, and many of the people at Partners in Health were physicians, with our training, can we make a preferential option for the poor in healthcare? What would that mean? And we decided that what it would mean is that we had an obligation to provide the best possible quality of care to the poorest people. That was the founding principle at Partners in Health. And again, going back to what my father told me, it was a marriage of scientific knowledge, practical skill, with a clear moral vision. In fact, Paul used to talk about AMCs, AMC. He talked about finding areas of moral clarity. And it wasn't easy, it wasn't straightforward. We had to think through lots of different authors and ideas. But the area of moral clarity that we focused on was when we encounter the sick in settings of extreme poverty, it is our moral responsibility to do everything we can. After Haiti, I went to this very poor area in Peru. We went to this community called Caraballo, a very poor community in the outskirts of the capital, Lima. And we thought we would do fairly straightforward public health projects. But then we stumbled upon patients like Melquiades. Melquiades had been suffering from tuberculosis for many years, and he had been treated and treated and treated again in a program in Peru, which was one of the best in the world. It was a really good TB program, but he kept being treated over and over and over again and not getting better. And when we met him, we immediately thought, oh my goodness, Melquiades must have drug-resistant tuberculosis. Because if you keep treating people over and over again and they're not getting better, the overwhelming likelihood is that the tuberculosis that they are infected with has developed resistance to the drugs that you're giving. And so the only way to treat people like Melquiades is to get the so-called second-line drugs, other drugs that go beyond the capacity or the pharmacy of programs like in Peru. And so we then, in the community of Caraballo, we found 50 patients in one city that had drug-resistant tuberculosis. And so in scientific terms, in medical terms, that's an outbreak. It was an actual outbreak. People were getting infected inside their homes. The ones who were sick were infecting the ones who were healthy. It was an outbreak. It was an emergency that we felt we had to respond to. But then here's what we found. Again, I just want to emphasize, this is where the clarity of our own moral purpose was so helpful. The World Health Organization had officially declared that drug-resistant tuberculosis in poor countries was untreatable. They said it was impossible to do. In developing countries, people with multi-drug-resistant tuberculosis usually die because effective treatment is often impossible in poor countries. MDR-TB, they said, drug-resistant TB is too expensive to treat in poor countries. Right? So this is coming from the World Health Organization. So this was gospel in global health circles. The Peruvian authorities were the darlings of the World Health Organization because they had been running a very good program. And so when we found these 50 patients, and when we started saying to the authorities, there's 50 patients in one community, there's going to be a lot more in your city, we need to start treating them. Right? What we thought would happen was we thought they would say, well, thank you so much for your concern. We really appreciate that you're trying to help us, but we think you shouldn't do it. That's not what they said. They said to us, if you treat a single patient, we will kick you out of the country. Right? So it was a very aggressive response. And that was exactly the time we thought, okay, this is the fight that we've been waiting for. So if you look at the statement, part of it says the drugs are too expensive, right? But in a meeting with all the different tuberculosis experts, I asked them a very simple question. You say the drugs are expensive, but do you know if the drugs are generic or are they branded and on patent, so that makes them expensive, right? So this is just the most fundamental thing that you have to ask, because if they're not on brand, if they're not patented still, you can make them for much, much cheaper in places like China and India. And so I asked these people, these were the people at WHO, World Health Organization, who made this policy, who declared this death sentence on all people in poor countries living with MDR-TB. I asked them, do you know if the drugs are patented or not? And they said, we don't know. They didn't know. They declared a death sentence on all poor people with tuberculosis, drug-resistant tuberculosis, without ever checking to see if the drugs were on patent or off patent. Right? And so Paul used to talk about this as the fecklessness of the global health elite. And so we learned something very important, right? Partly because they did not bring a moral vision to their science, they overlooked a really fundamental issue. And it was okay to overlook that issue because they were just dealing with poor people. And we had decided that we were going to make a preferential option for the poor and not ignore the needs of the poor. So when I was in Korea, I had studied the drug industry, the yakguks, in Korea. I knew a lot about drug manufacturing, and I declared to them, I said to the officials, look, we're going to reduce the prices and we're going to do it quickly, and we'll show you that price should not be an obstacle. So in about 4 or 5 months, we reduced the prices of those drugs by 90%. 90%. It was not difficult. And so this lesson was so powerful because what we understood was that people would bring science to the table, but because they were not focused on what that science meant for the poorest of the poor, they would overlook fundamental issues and declare death sentences without a second thought. Powerful lesson, probably the most powerful lesson in my life about why you need to bring science and moral clarity together. So this is Melquiades. We've got the drugs. We started treating him, and then I didn't see him for 15 years. And then when we had a World Bank meeting in Lima, he came to see me and he looked like this. He then became, he was an accountant. He was working, he had children, he was doing great. And soon after, we were successful in getting the death sentence removed in the I think it was around the year 2000. Then we looked around and we thought, oh my gosh, can we do this in other disease processes? And these are the activists who really pushed hard for access to HIV therapy. And among those activists, many of them were saying, now in 1996, 1998, we have the best drugs that we've made in a long time, and they are transforming the care of HIV. But what we found is exactly the same thing, exactly the same thing. The World Health Organization and everyone else in the global health world said that it is impossible to treat HIV in developing countries. But the person who's testifying before Congress in the United States is the head of the U.S. Agency for International Development. This is the man in charge of all overseas activities, including whether or not they should treat HIV in developing countries. And this is what he said at his congressional testimony. And he's not a physician. You can't treat HIV in developing countries because you have to take some of these pills 5 times a day, which was not true. He said, and Africans have no sense of time. They know morning, they know noon, they know dark of night. But if you tell them, for example, to take a medicine at 10 o'clock, they'll say to you, what's 10 o'clock? And so, first of all, having spent a lot of time in Africa, I knew that he was wrong, right? But he justified not treating people for HIV in Africa by saying that they had no sense of time, which is just completely not true. In fact, he had just visited an African country, and the representatives from that country said, after he said this, it was on all the newspapers, the African hosts of Mr. Natsios, the chairman, the African hosts said, well, it's very interesting that Mr. Natsios says that we can't tell time, because he was the only one who was late for every meeting with us. So again, taking science without moral clarity, what he was saying, what they were all saying at that time was, if you have HIV and you're living in a poor country, sorry, you're dead. There are medicines that can keep you alive for such a long time, but sorry, we don't think it's possible. It's too complicated, it's too expensive. Sorry, you're all dead. And so I was going around, again, with the Partners in Health idea in mind. I was saying, look, if we do not treat the 25 million people in Africa who are living with HIV, we will stand by passively as a genocide occurs. These countries will just collapse if we don't treat it. But they were saying, oh, come on, you're being unreasonable, it's not possible. And so, in Haiti, we started treating the patients with HIV drugs. This is Joseph June, who came to us suffering from both tuberculosis and HIV. And we started treating him for both, and a few months later, he looked like this. We call this the Lazarus effect of HIV treatment. Soon after, I became the head of the HIV department at the World Health Organization because my very good friend had become Director General, Dr. Lee Jong-wook, an amazing hero. And he asked me to come run the HIV department. We put Joseph June's before and after pictures in the most important report coming out of the World Health Organization. And I started a movement called 3x5. We decided, okay, we're not going to argue about whether it's treatable or not. We're going to set a target, we're going to go. And so we created this movement. There was so much controversy, and people, again, it wasn't that they were saying, okay, let's try, maybe it'll be okay. They were screaming and yelling at us saying it's not possible to do. From a scientific perspective, it's not possible to do. And I was saying back to them, but from a moral perspective, we have no choice. We cannot sit by as 25 million people die. And again, they said, you can't do it because the drugs are too expensive. So we created, inside the World Health Organization, a program to find generic versions, low-cost versions of HIV drugs in India and China. And we brought the price down again, not just 90%, but almost 99%. We brought the price from $12,000 per patient per year down to $70 per patient per year. So now in Africa and around the world, almost 30 million people are on HIV treatment. We didn't do all of it, but our organization, Partners in Health, played a big role in getting to this number. Unfortunately, it's being threatened now, but as the World Bank president, I can tell you that if we had not treated HIV in Africa, the economy of sub-Saharan Africa, I think, would have collapsed. So I hope this doesn't happen now, but the point I want to make is these were such important life lessons for me that if you don't marry moral clarity, moral vision with science, you're going to make some big mistakes, and the mistakes will impact the poorest. Because the poor don't really have a voice at these global meetings where all this is decided. Now, I took some detours after that. I was named president of Dartmouth College, and frankly, it was a lot of it had to do with the work that I had done in HIV. I was there for just 3 years, and then I got a phone call from the Secretary of the Treasury of the United States, who was a friend of mine, a Dartmouth graduate, and he asked me if I would come and see President Obama to interview for a job to be president of the World Bank. And so I told Tim Geithner, the secretary, I said, I've written a book that said the World Bank should be closed. And he said, yeah, we know, we've read it. But he said, come down and see President Obama anyway. So I did. We talked. He questioned me. And at the end, he decided that he was going to nominate me to be president of the World Bank. And Hillary Clinton's there because she's the one who actually put my name on the table. I'd been working with President Clinton and Secretary Clinton on these issues of healthcare in Africa. So I took over the World Bank. The World Bank had a great vision, which was our dream is a world free of poverty. And so we set targets for the end of poverty. Of course, COVID threw all that off, but it was a wonderful job. I continued to try to bring together moral clarity with science. And it was an amazing experience because I got to go to meetings like this all the time, right? And I think this is one of the first meetings because I didn't know that you were supposed to wave like this. And so I'm the only one not waving. But, Prime Minister of Australia, Chancellor Merkel from Germany, President Erdogan, President Obama, and of course my great 선배님, Ban Ki-moon. These were the sort of ceremonial things that were part of the job. But really, I went there to see if we could really put an end to poverty. This is what I found. The most disturbing thing that I found, I think, was that, and everywhere I went, aspirations were high. And I had the experience, of course, of going to Africa many times and meeting with heads of state and heads of government. And the question they always asked me was, hey, you're from Korea. How can we go through the same experience that the Koreans did? The Prime Minister of Ethiopia, when I went to see him, his first question to me was, what do you know about Semaul Undong? And luckily, I was an anthropologist of Korea, so I had studied Semaul Undong. But he said, we in Ethiopia, we think we can follow the Korean model. Right? We think we can go from being poor agrarian to fully industrialized in a short period of time. And so it was a source of great pride for me, always talking about Korea's great successes. But then after I left the World Bank, the Korean government asked me to help them to think about some of the major issues going on in Korea. And I'm very embarrassed to admit it, but I just didn't know the data. I didn't know what the science was telling us about Korea. So the suicide rate, of course, but the suicide rate is the highest in OECD, and it's been the highest in OECD for long. Everyone knows this. Everyone knows that the suicide rate is high. But every year, some of the data seems to get worse. Now it's the leading cause of death in Korea for people from grade school all the way into their 40s. And the suicide rate among the elderly is higher today in Korea than it was in the concentration camps in World War II. The prevalence of depression. The estimates are that Korea has by far the highest rates of depression in OECD. At the same time, Korea has the lowest rate of treatment for depression. There is no access or very little access to treatment for depression. Only the suspected prevalence of depression is over 25%, but the percentage of people who are getting treated is 2 or 3%, right? So the science, again, is very disturbing. If you look at birth rates, right? Well, again, I'm not telling you anything you don't know, but in 2023, Korea had the lowest birth rate, 0.72, the lowest birth rate ever recorded in human history for an entire nation state, right? And you hear stories now all the time in the Western press. Last year was the first year that anyone can recall in history where a country sold more pet strollers than they sold baby strollers. So people are choosing to have pets instead of babies. Now, again, I'm not judging. These are complicated issues, but I want to say that this is what the science is telling us. And so, again, putting on my World Bank hat, when I was born in 1959, the population of Korea was 25 million people, and there were 1 million children born the year that I was born, 1 million. Today, the population of Korea is 53 million, more than double the population when I was born. Over the last few years, the number of births has been about 200,000. So we have double the population, but the births are 1/5 what they were when I was born. Right? I can tell you economically, this is just not viable. Once the cohort that came through this very low birth rate scenario gets to the wage earning level, there is not going to be enough money to support the pensions, the pension services. Now, a lot of people say, well, we can be creative, and that would be great. But if the pension system collapses in Korea, you're going to add to already the highest rate of poverty among people over 65 in all of the OECD. In Korea, more than 40% of people over 65 are living under the Korean poverty line. But the Pew Charitable Trust did a survey, a very simple question: what's most important to you? And in all of the countries, all of the other countries, it's family, and then the next is usually occupation. Korea is the only country in all of the survey that said that material well-being was the top priority. Now, once again, I'm just presenting to you now the data. This is what the data tells us about what's going on in Korea today. So for me, the real question is, how can we do anything about this? What is to be done? How can we possibly respond to something that seems so overwhelming? And so Korea is famous for, at certain times, responding with great unity, great enthusiasm. So this is of course after during the World Cup, when Korea went to the semifinals. What an amazing time. But I would say this: any country can get excited and feel unified around a football team. Right? Any country can do that. And when you get excited and come together around a very happy event, Nobel Prize or whatever, any country can do that. But Korea has shown that in times of great distress, of enormous problems, of enormous challenges, it can also come together. These are pictures from the Gummogi Undong, the gold collection movement. I mean, the Korean people here, I'm sure, probably know this better than me, but people just came to the treasury, came to different places and gave their gold and silver. And some people say, well, it wasn't that significant, but that's not what I learned. Over $3 billion were collected. It was sent directly to the IMF, and it helped to shorten the time in which Korea repaid the loans. So this is one of the greatest acts of solidarity, of human solidarity, of national solidarity that anyone in the World Bank had ever heard of. So Koreans are capable of it. But then I also understand that something happened during the IMF shite. During that time, something happened to this culture. Sometimes here in Korea, when I talk about suicide, depression, lack of access, elderly poverty, when I talk about those issues, there are people even in Korea who say, but what can you do? You can't do anything about it. I just want to tell you a little story about possibility, about how to think about possibility. So every time I went to a developing country, I would go to school. And this is me in Tanzania. And then usually when I go to these schools, I ask them a pretty straightforward question. I say, what do you want to be when you grow up? And so this boy stood up, raised his hand, and said, I want to be president of the World Bank. Right? And I hear some laughing, because that's what everybody did. You can see the teachers and others were just laughing. And I stopped them. And I said, Back in 1962, before Korea got any World Bank loans, that was me. And I was at that time going to preschool near Sinchon, and I forget which preschool it was, but I was going to preschool. And I told them, if George David Woods, who was president of the World Bank at that time, when I was that age, it's completely plausible that he would have come to Korea to see, hey, maybe Korea can get a World Bank loan. And it's completely plausible that he, like me, would have gone to a school. He could have gone to my preschool. And what I told the people in Tanzania was, do you think that president of the World Bank in my preschool in Korea at a time when it was one of the poorest countries in the world, do you think he would have thought, hey, maybe one of my successors is in this room? So my message was, never tell a young person that they can't do something. Because that's what they were doing. They were laughing and saying, oh, come on, you can't be president of the World Bank. Never tell a young person they can't do something. And never fall prey to the idea that these things are impossible because of science. Right? If you bring the right moral conviction, the clarity of moral purpose, together with the science, there's no telling what you can do. And I have so much faith that the Korean people will figure out how to rise up and tackle these challenges in front of them.